Hi, Dr. Milan. How are you?
How are you, Dr. May?
I'm fine. Thank you so much. So excited that it worked.
I'm very glad.
I'm so happy, Dr. Fabio, that we are talking. And I'm super excited that if possible, you can for sure publish this Zoom call on your page, because maybe we will be able to do lots of, like once per month, we can talk about a topic, a joint topic, and we can announce the same thing we did for the live. We wanted to start when we did for the live for the general talking and so, but maybe we can put for them like topics. For me, I collect what they really me on the direct messaging and the posts, and I put as a live with Dr. Mai. Yani this month we're having 3 lives with Dr. Mai. I'm going live at 9 today after we finish the call, because they asked for the medications which interfere with the orthodontic treatment. And you know, the systematic review and the meta-analysis, I was super blessed to be a part of it, which studied the effect of medications like vitamin C, the calcium, the aspirin on orthodontics, and its effect, the bisphosphonates for the women who passed menstruation. So I wanted to talk about this today for them. So I'm having three lives this month. I think they hated me now because each and every Thursday they see me on a live, but they asked it so much and a lot. So, and it's very important that they know this, because what was done through the systematic review was a great revolution. I studied it with Dr. Athanasius E. Athanasiou, if you know him. He is my professor and my mentor, and I studied my master's with him. He was the one who interviewed me, by the way, in my master's program. And I recall on 2017 when I first saw him, I was joining the ADEC here in Dubai, and he told me in the interview, Mai, what's your plan B? I'm not gonna take you in the orthodontics. You're saying, yeah. You're saying you are passionate. No, the first question, you can call me Mai, and I'm gonna call you Fabio, okay? Because I feel this is too awkward to say doctors like this. This is not attached to our names, okay? So please feel free to call me Mai.
It's my pleasure. You're a very special guest. And
thank you very much.
I know Dubai. I was there twice, and please
tell me.
Please introduce you and where did you study? What's about your background in orthodontic, and which university you studied? Because in Brazil, the people want to know how is your practice and your orthodontic in Dubai, okay?
Yes, that's amazing. It's gonna be my pleasure to talk about this, and I'm super excited to talk about all these things. First of all, I love all the people from Brazil. They are super supportive, you can't imagine. And we agreed, stop calling me Dr. Mai. My name is Mai. I can't call you Fabio and you call me Mai, and you call me Dr. Mai. I'm gonna call you Dr. Micheliti, and then we will keep saying doctor. And I hate it. Let me tell you something about my background. When I was 8, my mom, God rest her soul, my mom passed away 10 years back. My mom was an assistant professor in the university, and my father, he got his master's, so he used all the time to drop me to the school with my brother, and he used to open the door for me for the car and tell me, Dr. Mai, please go to the car. I was 8, okay?
Okay.
So I just become like, guys, it's not attached to my name. Yes, I want to be a doctor. Actually, I wanted to be a cardiologist. I didn't want it to be a dentist from the first place. There's ironically, what do they call it? Story. I had my idol. He was the Professor Max Yacoub.
Hey, where are you from?
This is a very good question. I am Egyptian born,
Egyptian?
but I traveled to Edinburgh. And as you see on my page, I was honored and privileged to visit the Royal College of Surgeons of Edinburgh to do my master's with them. And I met Dr. Fraser. He's my idol and my mentor. I have been living with my family here. We are based here since mom's death around 10 years back. My mom passed away 26th of August 2010. So we don't have anything in Egypt, but I was born in Egypt. Okay. So I'm Egyptian born, but I don't have any roots there. My family and everybody's here in Dubai. When I finished in Edinburgh, I went to Nice, and it was my golden years there because I loved France so much. I was presenting my research and I studied obstructive sleep apnea.
In French? In French?
Yes.
Okay.
And obstructive sleep apnea, I studied it for two reasons. The first reason, it was the disease which killed my mom. And it was underdiagnosed. 10 years back, they didn't know that she had this disease. And they thought she has hypertension and diabetes and all these related symptoms. I was still in the university and in dental college, but I was her nurse. I used to see her when she used to sleep. She couldn't breathe. So I kept wondering, what's that? Like, it's something different. Then she passed away. I traveled and then I did my master's, and I decided I'm not gonna just stay to be a dentist. There should be something more, to be honest.
May, which is the university in French?
No, we studied, my dental college was, the first language was English. All my studies, my first language is English, my second language is French, and then the Arabic. This is why. Okay. We used to study French in parallel in the école, in the school, I mean, because it was like a mix. We had the teachers from France and from England, so we didn't speak except these two languages. When I traveled to Nice, I didn't speak except French because Nice is a small town. It's not like Paris. They are not so much familiar with English. They're so simple in life. You know, you don't drive there, Fabio. It's you put some charge to take the velo. And this is why till now here in Dubai, I have a bike. And I take it, and it's like my best time of the day, even if it's gonna be 10 minutes to cycle around my house, because I adore cycling. I just forget anything and just think of what can I put in a positive thing during the day, because I love cycling so much. In Nice, they are so like simple people. They take scooters, they use the velo, which is the bicycle. So it was an amazing stage of my life. Then I have to come here because my father, unfortunately, he got Alzheimer and dementia. And I had to be with him because he couldn't realize anyone in the world except me. I was his mom and his wife and everybody. He didn't marry after my mom. So I had to stay here with him. And this is how I sacrificed doing the master's in Birmingham and did it here in Dubai. Because of this, I did it in Mohammed bin Rashid University, which is the top college here. I got a scholarship, alhamdulillah, because here
what's the name of university?
Mohammed bin Rashid University of Medicine and Health Sciences. Okay. It's the main one for His Highness Sheikh Mohammed bin Rashid is the ruler of Dubai. So his university is the main specialized in postgraduate studies.
Awesome. May, how is the demand of orthodontic patients in Dubai? Your patients are Emiratis or Europeans or a mix of them?
It's a very nice question, Fabio, and I don't know if you'll be surprised or not, but I have 93 patients. You can say that only 23 of them is Emiratis, and the rest is a mix, mainly in Dubai Dental Hospital, where it is the partner of my college, where I used to do my master's. We had here in Dubai, Fabio, treatment is related to insurance. Each and every big company secure her employees insurance in some places. Dubai Dental Hospital was covering the Emirates Airlines insurance. So this is why all the pilots from and their families and their kids and their wives were all our patients, because we have all the Emirates crew.
See?
So most of them are Europeans, French, Mexicans. Here in Dubai, there's a huge variety of nationalities, and we are blessed in having, peace. Like, each and every one is so supportive. Each and every one is going to the challenge, to the competition, to be better and to add. And this is amazing. I wish really to be able to welcome you someday. You and all my friends from Brazil, guys, were super, super supportive people. I love you so much, though. And I want really to visit Brazil. You can't imagine the interactions, Fabio. Sometimes I go to pop-up lives, and it's very early in Brazil. And then I find them all joining and saying hi from Brazil. I just can't imagine. You're super nice people. And your work, Fabio, is amazing. You're one of my idols, I can say. And I wish really we can work together, like in a lecture or so. I would invite you so much.
Thank you. I will invite you to come to Brazil
for sure. But really,
some lectures. You are be my special inviter. Okay.
My pleasure. My pleasure.
Special guest.
My pleasure.
Mai, how do you manage these ethnies and their malocclusion? Because I think Indians is very class 2.
Yes.
Asian Orientals are very crawl and class 3. How do you manage? I think it's very difficult to manage this kind of ethnics, this kind of mixed ethnics in your practice.
Exactly. This is a brilliant question, Milana. Fabio, I will tell you something. This is what made me really start the Instagram account. My Instagram account, by the way, is so recent. It's like around 1.5 years now. But because of the ethnic population variety, I really wanted to tell people about the beauty of orthodontics. Like, we are dealing with genetic traits. They should be understanding that what they have sometimes can get us some limitations, and they should really deeply be aware and understand what we are really doing. It's not like they are just visiting their dentist, Fabio. I don't know if you can imagine, and if you agree with me or no, but orthodontics is different. They are not just coming on to take a filling, to put a filling, or just to put a veneer to look nice. It's we are treating what we used to teach, the residents, when we used to tell them, it's the science of putting the harmony back to the occlusion. Harmony is a huge word, because when you say harmony, meaning you're talking about upper lower jaw, teeth, face, eyes, and everything. You're talking about a whole perspective of the facial analysis. You're not just dealing with the tooth. This is why orthodontics is different, and we are scientists. We are not only doctors. And by the way, when I just presented to Professor Athanasius before joining my master's, he told me, why do you want to be an orthodontist? So it was me before studying orthodontics, but I just took the decision I will do my master's in orthodontics. Then I told him orthodontists are scientists. They're super passionate to change like the lives of their patients. What was his answer, Fabio? He's my mentor. He left Dubai. He is now in Greece. But I always send him a message every week to say happy weekend, prof, and hope all is going well. I hope to see you soon. By the way, he was my examiner. He was my external examiner from Greece for my thesis dissertation. I will never ever forget. It was so early in their time, but all my professors, just one was in Colombia, and it was like 1 a.m. at his time, and Professor Athanasius was like 6 a.m. on his time, and they sat for my thesis defense for 1 hour. I will never forget all these because this was amazing.
How do you speak Spanish?
No, unfortunately, I wish. No, I wish. No, it's only.
Do you do children's orthodontics in Dubai?
Pardon?
Do you do children's orthodontics? Do you treat children's?
Of course. We have in our orthodontic department. Yeah, we have in our orthodontic.
Very popular. You treat in childhood, and after you treat orthodontic, but it come more easily to treat later orthodontic. Yes. How do you practice?
Now we have. If you are talking about interceptive orthodontics, we have a special department. We have a special department for interceptive orthodontics, and I'm super blessed to be a part of this department. I work with my colleagues from pediatric dentistry to establish the better appliances in the treatment. And you know what, Fabio? I really wish we can have the room to talk in each and every episode, maybe once per month, to spread awareness about the effective appliances which can be used in the age before puberty, how they can really influence the growth of the children to prevent them from the risk of having surgery once they are past the growth. This is very important to spread awareness about. And
because there are some countries that they did not do the child orthodontic, the intersective orthodontic.
Unfortunately, there are some countries, and this is why the American Association of Orthodontics, I'm blessed to be a member since 2017, advocates that the children should be having their orthodontic first checkup visit at the age of 7. Because at the age of 7, when the pediatric dentist will refer them to the orthodontist will be able to spot major problems. Like imagine, for example, crossbite. If the patient has a crossbite, imagine if he's treated by 8, it's going to be super easy. Maybe like a unilateral expander can solve the issue. But if he's 12 and this crossbite is now a lateral shift or lateral excursion, it's going to be a huge thing. Actually, if he developed like a lateral open bite, was going to be worse and need more treatment. So I was just saying the crossbite as an example, but if really people can have this awareness, the issue, Fabio, is that to spread this, we need not only Mai, we need everybody from all the world to unite, to say more lectures. The thing is, there is a proverb they used to say in our culture, repeating, just emphasize on the power, which means when you repeat things, by default, things will go to the minds. But when you just say it once, twice, 3 times, okay, yeah, I remember 10% of what was said. But if Mai talks, Fabio talks, from other countries they talk, we all unite, things will really, as I was saying, we are scientists, not only dentists. Absolutely. People should really value this.
Yeah. I agree with this proverb. Mai, tell me one thing. We have more 4 minutes. Are you a lecturer? Are you a professor?
Well, I wish. The thing is, to be a professor, I need to apply for my PhD. And I'm currently doing this. I wanted so much to proceed in obstructive sleep apnea to do my PhD. But I used to teach my colleague fellow residents because I was the head of the scientific committee when we were in the master's program. And I won the best prize for my master thesis last year in the ADIC. I would so much invite you to attend the attic this year. It's going to be on the 29th of June. Hopefully things will settle down. And now there is a vaccine in Dubai established by Pfizer, and another one which is established by AstraZeneca. We are testing both in Mohammed bin Rashid University against COVID. The thing is, it's still in the testing time. So sometimes people immunity is different. Sometimes people take it and it's not working. But till June, I'm very optimistic that things will really settle down. Hopefully, it will be my ultimate pleasure to welcome you here. You will really, really, really enjoy the attic. The attic is the biggest congress to be done through UAE and all the Gulf countries, to have all the dentists from all over the world lecturing and presenting their work. It was my first time to come here in 2017, attending this ADIC. 2020, I won my best prize for my master thesis, and I'm applying for the Ortho Congress to present a lecture there this year. So I wish so much that you can join me. It's going to be my ultimate pleasure. It's from 29th of June till 3rd of July. So
I think you should go ahead, because your work, your Instagram is very, very beautiful. You are.
Thank you very
you
much.
have so many treatment, very, very beautiful.
Thank you very much.
I have the last question today. Okay.
Sure.
How do you see the self-ligation braces? Do you like? Do you use them?
This is a brilliant question. Let me tell you my opinion. And I had a professor. He was my professor in the university. He's Greek as well. His name is Eleftheris Kaklamanos, and he was like a mentor to me. And he did his master's thesis on self-ligating brackets efficiency. So he studied clinically if they are really efficient other than conventional braces, and I'll tell you the results. Fabio, here in Dubai, we use self-ligating, but not much. Why? For two reasons. Here, braces mostly are so loved by kids. They come, they want colors. They are so curious and eager to change the color in the Halloween, in the Christmas, and these things. For adults, they love the conventional braces and they hate the ceramics because they feel the ceramic is so bulky. And they feel that when we put the ceramic, especially women after 40s, they call me, Dr. Mai, I feel that my lips are coming out. And we hear here in Dubai, it's so popular that people do lots of Botox and fillers and so. So she has like her appointment of Botox and fillers every week. And she goes there, comes to me, tells me, I feel that my top jaw is going so much. My doctor for the Botox is saying that it's going so much. I tell her, my dear, go to your doctor, let her fix your teeth. What's that? you know, they are influencing our work. You see, this is why it's the culture. For us, self-ligating, I haven't worked except one case from all the cases, because the issue of the wire to get stuck is a big issue, especially in kids. They freak out. Like when the kid has his braces, you know, the amount of wires coming off from the patients, and they're not complying to eat the no foods, as we call them, like the sticky foods, and these foods here is so high. People are not cooperative at all, and they forget, they bite, they don't care. And you know what's the issue is that they leave the braces out of their place and the wires out of their place till the next visit. So they come, like you are putting a 1622 night eye, for example, and you're just ready to move to stainless steel, okay? And then the kid comes to you, like losing his bracket on the 5, for example, since 2 weeks. So the 5 is like this, and the rest of the teeth are actually aligning. You can't, you just say, Fabi, oh my God, guys, I'm gonna go back to 016 Nai Tai and start the journey from the beginning. I'm just telling you what's happening, because, and you see you're laughing, but really, and I keep telling them on Instagram and on my live, guys, please, if a bracket came off, you have my personal number, please send me, I will drop you in. No use, they just don't want, you know, just they were waiting to change the colors and the looks and these things.
Okay.
For us, self-ligating is not so popular.
We want to change the colors, okay? It's the,
yeah.
the most reason to...
yeah, especially among kids, yes.
Yeah, okay. Oh, doctor, sorry, May.
Yes.
Thank you for today.
My pleasure, my pleasure.
I think we can repeat some others' lives, because the Brazilians want to know Dubai, wants to know you, and
my
very
pleasure.
You go to Brazil, and it will be my pleasure to be with you, to go to Congress here in my country.
Pleasure.
And when I go to Dubai, I will visit you.
Of course, it's gonna be my honor. Khalas, we agreed. You just try to schedule the. I'll send you the ADIC Instagram account. Please follow them. For even you will have a look about the lectures and the congresses, because they started posting about the speakers, and we will be more. We will really, it will be a great chance to coordinate to spend this week in Dubai. You will be like doing like what we say in a proverb, because you love our proverbs, like hitting two birds with one stone. It's like you're gonna come for the Congress. The Congress is already 1 week. There is a pre-Congress course for orthodontics, 2 days. And then the Congress starts on Tuesday, Wednesday, Thursday. So maybe you can visit, like you can come to Dubai on a Friday, spend Friday and Saturday enjoying the scenes and everything. And in June, it's going to be summer. So you're just coming for the beach. It's purely summer. It's going to be 50 degrees Celsius. So prepare for that. No, we actually now it's 33 degrees Celsius. Winter's done in Dubai now. Starting the end of Feb, today it was 33 degrees Celsius. So by June, it's going to be 50. yeah.
At the summertime, it's so hot. Okay.
50 really. 50, 50 really. But we are blessed that we have lots of beaches, you know. So things are really nice, are really enjoyable.
Yes.
And the Congress is actually postponed to that time till the COVID issue is sorted, because they didn't want to do it virtually, like the World Federation of Orthodontics meeting last year. I was blessed to be a part of this meeting, but it was a virtual Congress, the one which was held in Japan. I was presenting 2 researches, one a case report for a camouflage treatment for class 3 adult orthodontics, and the other one was my master thesis, but it was virtual. It was done online. It was planned to be done, of course, in Japan, in Yokohama. Since 2 years, people were booking, and then, you know, the COVID times and what happened made everyone stop. So they had to turn it as the first virtual Congress in the world. I was blessed to be a part, but for the ADIC, they're having different plans, because as I'm telling you, Fabio, you know, things, alhamdulillah, are being settled in Dubai, especially after the vaccine release. So people are now, you know, they are trying to take the vaccine. They're trying to accommodate, you know. Actually, I'll tell you something. Most of the people here got COVID, and they are now, you know, they are now feeling better. It's ironically, COVID is because we don't wash our hands. Can you imagine? You know, if we thought of it like this way, yeah. If you thought of it like this way, it's simply this virus is killed by washing the hands. But because we are now so careless and so in a rush on everything, it spread like this. So most of the people now have it, but they really get very well when they take care of their hygiene, take their vitamin C's and magnesium and curcumin and vitamin D, and all goes well, and they settle for 2 weeks from all the stresses, they just get cured. So hopefully, it's just dangerous for the people who are very elderly, or the people who have other diseases like diabetes, hypertension, whom we call them the immunocompromised patients. Other than this, people just take it and it goes away very well.
Okay, May, thank you for tell us some histories from your country. Thank you for your precious time to join us, Micheletti. We will have some futures meeting between me,
of course,
my partner Rodrigo Milani, and you.
My pleasure.
It will be my pleasure to receive you again. Okay.
Same here, and it has been really. You say another proverb, a third proverb for today. Beautiful time passes fast, and really, I didn't feel the time. I didn't know that it's now. Oh my God! I have to join another live at 9 a.m.
How is your proverb?
Beautiful time.
Beautiful time.
Passes very fast.
Beautiful time passes very fast.
Very fast.
Oh.
Yeah. I
will speak in Portuguese to Brazilians understand. Tempo, quando a coisa é boa, o tempo passa rápido.
That's okay. Amazing. I love Portuguese so much. They always write it in my page, but I don't understand anything. I use the translator, and they use the translator. My pleasure. Thank you so much, Fabio. And bye. See you.
See you.
Bye.
Bye-bye.